The chair lays out floor amendment number 5 by Senator Van de Putte. The secretary will read the amendment.
Floor amendment number 5 by Van de Putte.
The chair recognizes Senator Van de Putte to explain floor amendment 5.
Thank you, Mr. President. Mr. President and members, this amendment also deals with the way that the drugs are used. If you remember correctly, during the first special session, I had an amendment about the FDA label requirements. We discussed what, if you remember, the best practices were, and the American College of Obstetricians and Gynecologists pointed out that the regimen in the FDA label for use of the medication is 13 years old, and it's been proven to be outdated and less effective than the current best practice. As a result of that, working with Dr. Schwartner and Dr. Duell offered an amendment which is reflected in, I think, the current bill language that really makes sure that it was the correct dosage. If you remember correctly, at that point it was the old label which had a 600 milligram dose, and it's really a 200 milligram dose. So I really appreciate that we did use current medical practice. However, since that last special session, it's been brought to my attention that the safety and effectiveness of the medical procedure is not simply related to the dosage amount, but to the method that the drugs are administered. And I'd like to just visit with you a little bit about the different applications of dosages. Many of you know I've been a pharmacist for 34 years, and there are medications that can be taken orally. The same medications can be used topically. Some medications can be taken orally. As you know, when babies are sick or adults are sick, sometimes they use suppositories, either rectal, and for a lot of cases for women, you can take oral medications or you can take the vaginal preparation. The dosage amounts are important, and during the last legislative special session, that was corrected. I'm very pleased to see that that language is retained. But the FDA label requires that the second pill, misoprostol, to be taken orally. The multiple clinical studies have shown that administering misoprostol, which is the second tablet, vaginally results in fewer side effects and is safer and more effective overall, meaning that fewer women will suffer complications and the need to return for those complications. I really believe my colleague, Senator Hager, when he tells me that he really believes this is about the safety and health of women. And so I bring this amendment to you because the amendment simply allows the physician to administer that second drug either orally or vaginally on a case-by-case basis, according to the best practice guidelines of ACOG, the Congress of Obstetricians and Gynecologists. We really should default to their expertise to make that determination. If the goal of this bill is to truly improve the quality of health care, then we really need to allow the physicians the flexibility necessary to keep women safe and healthy as possible. Members, there have been results of clinical studies. The amendment does not require a certain method of administering the drug. It simply allows the physicians to make the best healthcare decisions. In a letter that we received from the American Congress on Obstetricians and Gynecologists, on their 5th paragraph, it's noted, furthermore, the misoprostol dose, although on the lower dose, is given orally in the FDA-approved regimen, whereas in most practice it is administered vaginally based on that evidence-based regimen. Oral administration results in higher peak levels of the drug. It'll have the increased side effects, but together with the evidence-based regimen, the lower dose combined with the second dose being administered vaginally acts superiorly in the FDA-approved regimen with less complications for women. So members, I hope that you think about what we did in the other special session, where we did allow, if we're going to do this, to please have the safest and the most effective regimen for women. And so what I do here is make sure that we adhere to what is in the best practice and allow the physician to decide on the second dose of the drug, whether that should be administered orally or vaginally. Let's leave it up to the physicians so that there is less side effects for the women, so that there is less complications. And I would hope that, just like we did last time, that there was a way to incorporate the medical decisions that are the best practices and are reducing those complications, that we adopt this amendment as well.
Thank you, Senator Vanderpute. The chair recognizes Senator Hager.
Thank you, Senator Vanderpute, and I thank you for the discussions we had here a couple weeks ago on this, and you're right, points that were made, and we did make some changes. I do not think that this bill, in saying that the person, the physician who gives, sells, dispenses, administers, provides, or prescribes the abortion-inducing drug, who is the physician, requires, dictates that it be provided one way or another. And so, therefore, with all due respect, I'd ask that we table Floor Amendment 5.
The chair recognizes Senator Vanderpute to close.
Members, on the clinical studies, there is a 7% difference on complications when the second drug is given orally or vaginally. Just like we did last time, to make sure that physicians and the patients were using the regimen, all I do on this is allow that amendment to go into effect so that the medication is given either orally or vaginally, as outlined by the American Congress of Obstetricians and Gynecologists. It's in their practice bulletin. That's what the standards are. And if you go by the FDA label, even though we changed it, it doesn't allow for that vaginal, and you're going to have more complications. I know we corrected it last time. Senator Campbell reminded me that oral also means buccal, which means that you put it in under the tongue or on the cheek, and it's dissolved. So technically, it's put in the mouth, but it's dissolved. So just so that you know that things are complicated in that the dosage forms are different. So I appreciate that, but I'm really concerned if we're going to be about women and women's health, then let's let the physicians use the dosage form that presents the least complications from the procedure. And I would respectfully ask that you vote no on the motion to table.
Members, the issue before us is the motion to table by Senator Hager. The Secretary will call the roll.
Birdwell, Campbell, Corona, Davis, Duell, Duncan, Ellis, Eltife, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Schwartner, Soliger, Taylor, Uresti, Vanderpute, Watson, West, Whitmire, Zaffarini.
Members, there being 18 ayes and 12 nays, the motion to table is sustained.
Thank you, Mr. President. Thank you, members. Thank you,
Thank you,
Senator
Senator.
Hager.
The chair lays out Floor Amendment number 6 by Senator Zaffarini. The Secretary will read the amendment.
Floor Amendment number 6 by Zaffarini.
Chair recognizes Senator Zaffarini to explain Floor Amendment 6.
Thank you, Mr. President. Mr. President and members, this amendment would require the Health and Human Services Commission to reimburse any abortion facility constructed before January 1st, 2014 for costs incurred by the facility in order to implement and comply with the increased standards required by House Bill 2. Testimony was provided that it would cost anywhere from $50,000 to $1.5 million. Senator Hager estimated an average cost of $250,000 to remodel existing abortion facilities or build a new ambulatory surgical center. This is the sole reason that most abortion clinics across Texas would be forced to shut their doors if House Bill 2 passed. Most abortion clinics are operating at a loss and cannot afford to remodel their buildings within the year provided by House Bill 2. If the state is going to require abortion facilities to remodel their facilities to meet a new set of arguably unnecessary but different safety standards, the state should help cover the cost. Mr. President, I move adoption.
Thank you, Senator.
President,
Senator Leticia, for what
Senator
purpose?
Sabrina, yield for a question.
I certainly do.
Who are the owners of these facilities, these clinics? Are they private or are they public? Who owns them?
Senator, I'm not an expert on licensed abortion facilities. Different people own them, some organizations, some individuals, and they're private.
So would you be subsidizing private business with state dollars?
Well, you would be paying for the cost that would be demanded by the state. If we do not adopt this amendment, then it will be an unfunded mandate.
Thank you, Mr. President.
Chair recognizes Senator Hager on floor amendment number 6.
Yeah. Thank you, Mr. President. Members, I would ask, with all respect, that we table this amendment.
Chair recognizes Senator Zaffarini to close.
Thank you, Mr. President. I hope that you will support this amendment, members, because a vote to table this amendment is a vote for an unfunded mandate.
The motion before us is the motion to table by Senator Hager, opposed by Senator Zaffarini. The Secretary will call the row.
Birdwell, Campbell, Corona, Davis, Duell, Duncan, Ellis, Eltife, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Schwartner, Sulliger, Taylor, Uresti, Vandepute, Watson, West, Whitmire, and Zaffarini.
Members, there being 19 ayes and 11 nays, the motion to table is sustained. Chair lays out floor amendment number 7 by Senator Rodriguez. The Secretary will read the amendment.
Floor amendment number 7 by Rodriguez.
Chair recognizes Senator Rodriguez to explain floor amendment 7.
Thank you, Mr. President. Members, Senator Hager, as we discussed, if this bill passes, only 5 of the 42 existing abortion facilities would remain open. And I know that some of you dispute this, but this is what is the conventional wisdom about this out there. It would only leave 1 in Austin, 1 in Dallas, 1 in San Antonio, and 2 in Houston open. However, many of the 37 facilities that will be shut down by this bill provide family planning and preventive care, including breast and cervical cancer screenings, contraception, well woman exams, pap smears, and STI screenings. Based on the type of services that these facilities provide, the standards that they will be required to comply with by this bill are inappropriate. In comparison to these facilities, the ambulatory surgical centers are primarily used to perform sterile surgical procedures that typically involve an incision. For example, surgeries to remove tonsils, gallbladder, or kidney stones. These surgical procedures generally necessitate 2 to 4 hours of anesthesia and recovery time. ASCs are designed for such procedures and often require operating rooms with certain standard sizes, wide corridors, ventilation systems appropriate to maintain sterility, and other requirements that provide no medical benefit in the context of an abortion procedure. The vast majority of abortions are procedures that can be performed safely in an office-based setting without surgery or anesthesia. Therefore, these requirements are inappropriate and unnecessary. This amendment exempts abortion facilities from having to meet the construction requirements for ASCs. Mr. President, I move adoption.
The Chair recognizes Senator Hager on floor amendment number 7.
Thank you, Mr. President. Thank you, Senator Rodriguez. I believe that this would take away substantially the purpose of the bill of trying to raise the standards for health care, and with that, in all due respect, I'd ask that we table the amendment.
Chair recognizes Senator Rodriguez on floor amendment 7.
Members, I think we have heard plenty of discussion about the authorities, including the ACOG and others, indicating that these standards are unnecessary for these abortion procedures, and that what they're going to do instead is create a hardship in terms of women having to access these services, as at the same time impose additional prohibitive costs to these clinics being able to maintain their doors open, and result in the closure of many of these facilities, and thereby creating more problems for women seeking these services. So I would ask that you vote no against the motion to table. Thank you, Mr. President.
Thank you, Senator Rodriguez. Members, the issue before us is a motion to table by Senator Hager, opposed by Senator Rodriguez. The Secretary will call the roll.
Birdwell, Campbell, Corona, Davis, Duell, Duncan, Ellis, Eltide, Estes, Frazier, Garcia, Hancock, Hager, Hinojosa, Huffman, Lucio, Nelson, Nichols, Patrick, Paxton, Rodriguez, Shortner, Sulliger, Taylor, Uresti, Vanderpute, Watson, West, Whitmire, Zaffarini.
Members, there being 19 ayes and 11 nays, the motion to table is sustained.
Thank you, Mr. President. Senator Hager.
Senator, thank you. Chair recognizes the chair lays out floor amendment number 8 by Senator Uresti. The Secretary will read the amendment.